Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the 12 winning senators will finally be proclaimed this afternoon. The Commission on Elections says presumptive winners are allowed to take their oath earlier than June 30th. COMELEC Commissioner George Garcia joins us live. And the Health Department confirms local transmission of a new Omicron subvariant in the country. Infectious diseases expert Dr. Rontgene Solante also joins us in the program. Health officials have confirmed local transmission of a more transmissible Omicron subvariant in at least 3 areas. So far, BA.2.12.1 is neither a variant of concern nor interest. But earlier studies say this may just be the most infectious form of COVID-19 yet. Let's go straight to the source of the story. First off, we have infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, welcome back to The Source, and it's good to see you again.
Yes, good morning, Pinky.
So the DOH has confirmed there is now local transmission of the Omicron subvariant BA.2.12.1, but not yet a community transmission. I guess it's best right now to refresh our memories regarding this. Tell us the difference between a local transmission versus a community transmission.
Okay, first, local transmission is that there's already transmission coming from our own resident and not coming from abroad or any other source, not in the country. So meaning not exposed to a foreigner or not exposed to a returning overseas Filipino. So meaning there was no exposure from those two individuals that got it from other countries. So meaning there's this, they got it and he don't know where he got it. So most likely coming also from a local. No? And community transmission is that if there will be more clusters of cases coming from that local source or index case, transmitting it to more Filipinos within the community.
Right. So far, there have been 17 cases recorded. 16 of these are what is called the local cases. And the other one, the 17th one, is a returning overseas Filipino. With a number of 16 local cases, would you find this already concerning?
Not at this point in time, no, because remember, Pinky, we have limitations, no. When we do the sequence, the specimens that are given for the sequence are only very limited, and only those who are given the positive, and not all the specimens are being sequenced. Second is that we don't know for those who are having the symptoms now who are positive are really having this new sublineage or subvariant. No? So for one, it may not be a concern because we don't have yet an uptick of the case, but that's what we are trying to monitor in the next few days or few weeks. Because if there will be an uptick of the cases, then obviously that's because of this highly transmissible sublineage of your Omicron variant.
But the thing, I guess, Dr. Solante, is that if there are people who are experiencing symptoms, possibly the kind of test they'll be doing is the antigen test. And if you do the antigen test, that doesn't allow it to actually go into a genome sequencing, because it's the RT-PCR tests that have the capacity to be able to be genome sequenced. So we're probably not seeing the actual numbers. Would you agree?
Yes, correct. No, and agree with that. In fact, a lot of those who have symptoms, mild symptoms, are not submitting themselves for testing. No, and like for example, I'll give you an example. There is one positive and 2 or 3 of the members are also positive in the family. But since they knew that the one that is positive has the COVID, then the 3 did not submit for the test because they knew that it's also the same as that because they have the same
Right.
symptoms. So they just isolate themselves. No? So those are the limitations now because of the number one, the cost of the testing also is the one limitation.
So this could be an underestimation, the numbers that we're seeing right now, 17 in total of the subvariant BA.2.12.1.
That's a possibility because of the limited number of persons that are being tested, and those who have symptoms are not really going not into mode of getting themselves tested.
So looking at the situation right now, we have very relaxed rules right now, pre-pandemic levels even. With this announcement of a local transmission, do you think it's just a matter of time before we see a surge? Or, Dr. Solante, could we already be immune to this, knowing that it is a subvariant of the Omicron, to which back in December or early January, many, that's the time we saw a surge in the Omicron cases. Maaari ba kayang immune na tayo dito?
Okay, that's a good question. No? I would like to give you some scenarios here. If our wall of immunity is still good, since we have been exposed to BA2 in January and we have that natural immunity, and a lot of the population are already given the primary vaccine series, then we still have a good protection against the BA2.1, 2.1, and most likely we will not be experiencing surge or spike. The other scenario here is that what about those who were given the vaccine and those who were not vaccinated, especially those vulnerable population that did not receive the booster, where protection is important for this heavily mutated variant, then that can be a possibility that we can still have spikes and surge, but not as high as what we have experienced from that with the Omicron variant BA2 in January.
But even if a lot of us, for example, have had our primary doses and even a booster, the lifespan of that would really be what, 6 months. So let's give one specific scenario wherein tapos na po tayo sa primary vaccine and then we were boosted sometime in December or even January. Does it mean that by June or July, our immunity from this subvariant of this Omicron could be waning by June or July, by the months of June and July?
Okay, the data is that it's difficult to really estimate how long the protection will be when we receive the primary vaccine series. Okay, but we're sure that within the 3 to 4 months we're still protected against the severe infection. But we are not protected against getting the infection because of this heavily mutated variant. So we may get the infection, we may have symptoms, but our protection against severe infection when we are vaccinated, especially those boosted, are still there, no? Mataas pa rin, no? Kumpara doon sa walang bakuna. Now, ang tinitingnan natin dito, bakunado ka is primary vaccine series, pwede ka pang magka-infection. Bakunado ka, meron kang booster, pwede ka pa rin magka-infection, but your protection against severe infection mas mataas kumpara doon sa dalawang bakuna lang.
Right. When would you say, siguro so we understand it better for those who have had their primary and booster shots, when do you say that medyo mababa na po yung ating immunity?
Okay, ang recommendation natin kung nakatanggap ka ng primary vaccine series, dapat 3 months after matanggap mo na yung booster dose mo. So for example, November, December, natapos mo na yung dalawang bakuna, no? So you are at risk of getting the infection because of this variant Omicron mga April, May. Okay? So that's why kailangan pa rin talaga natin na emphasize ang booster because giving the third booster shot will increase your protection against getting the infection, being symptomatic, at least 60% within the first 3 months. No? And then pababa yan siya, hindi natin alam how long it will go down. And that's why the second booster is recommended for those who are vulnerable. When you say vulnerable population, yung mga population nito na pag matamaan, kahit dahil ang booster nila may not be enough to protect them against severe infection, kailangan silang bibigyan ng pangalawang booster. And these are the immunocompromised at yung mga 60 years old and above and with comorbidities.
Yun ho ba papayagan na yung second booster?
I think yung napapayagan pa lang is the immunocompromised, no? And I think we've heard that anytime this week, hopefully the Department of Health will have the recommendation also for the second booster for the healthcare workers and those 60 years old and above. And we're waiting for that recommendation.
And that might be very, very important, no, Dr. Solante, because obviously the healthcare workers are the ones exposed first and foremost. And then yung mga seniors, sila yung for the most part, classified na mas mababa yung immunity.
Yes, importante yan dahil ang 60 years old and above, talagang yun we have to protect them, no, against severe COVID because of the benefit of the bakuna is decrease the mortality, no? The healthcare workers, because we want to protect them, since during this pandemic, we need the healthcare workers to maintain the viability of our health system.
Right. And do you see it as a problem that those who have had their booster shots, hindi pa po marami yung mga kababayan natin na nagpapa-booster?
Yeah, that's the problem now. And I think our Department of Health is really doing a lot, no? Exhausting all means on how to increase the uptake of the booster. Wala namang pagkukulang doon, no, sa pag-emphasize ng importante ng booster, no? But it's just that yung uptake, yung mga tao, konti pa ang pumupunta sa mga vaccination center. And I think this is an opportunity, Pinky, no, that when we have this BA.2.12, this is now our opportunity, again, to emphasize and tell the people, you will need the booster. If your primary vaccine series, you are able to complete that, you need a booster for your protection, added protection, and more or less, no, to prevent the surge and spike of cases.
And why is it that I know there have been calls for the definition of full vaccination to actually include a booster shot? Ibig sabihin, hindi lang yung 2 primary doses, pero kailangan na dagdagan ng booster, which is a third dose, to be able to be classified as full vaccinated. Why do you think until this point that definition of full vaccination has not been resolved?
I think I don't have any definite answer for that because, in fact, our group, the PCP, also wanted to have that in terms of updating the definition so that people will be encouraged, especially for those who are working, who are always exposed, to encourage getting the booster, which is very important at this point in time that there is still the pandemic still with us. No? We're even though cases are low, but that's not something to be happy with because of variants of concern being a possibility that can affect our number of cases in the next few months or in the next weeks.
And lastly, I just wanted to get your thoughts, pick your mind on this. Siguro, with the relaxation, with when we go around, we're seeing really pre-pandemic levels, people going out, they're out and about. Does it look good for the country right now, especially after the elections? There were so many gatherings, minimum health protocols were really not strictly followed, and yet we're still seeing such a low number of COVID cases. Are we headed in the right direction?
Yeah, I think so. No, we're headed in this right direction because as of now, as I've mentioned, the cases are really low, and I think the number of those individuals with the primary vaccine series has been really enormous. Also, mataas na rin. So we still have that wall of immunity. The only question then is that if this heavily mutated variant can cause a spike or what we call this surge of cases, Ang importante lang dito na sana hindi mapupuno ang hospital, no? Kasi yun naman ang
Right.
pinaka-importante na we need to protect the healthcare system. Walang mga pasyente, walang mga tao na mag-severe, walang pupunta sa mga hospital na naging severe na ang condition. And I think even with the mild case, that's acceptable as long as people are not dying and not going to severe COVID.
Dr. Rontgene Solante, thank you so much for your time.
Thank you, Pinky.
Thank you. And we will be taking a short break. This is The Source on CNN Philippines. Please stay tuned.